Hello everyone, you are with us at All About Physiotherapy. Today our guest is Dr. Romulo. He's an orthopedic surgeon and today he has given us his valuable time and we appreciate it and we start our question answer session with him. Hello Dr. Romulo.
Hello, my friend. How are you today?
I'm good. How are you?
Very good.
And what about the corona thing which is going on in the world?
Yes, we're safe.
Yeah, are you safe there? Your people?
Yes, of course. Yes, of course.
Okay, so should I start with the questions?
Yes, let's go.
Let's go. My first question is to you is tell us something about your career. How did it start? And
Well, when I talk about my career, many things come to my mind. Uh, for example, to get started, I can say only one thing. The orthopedic surgery is the most beautiful career in the medicine.
yeah, right.
And maybe you asking me, why? Well, because you can study the perfect human body anatomy and biomechanic system. Uh, that can help me to treat the different orthopedic diseases. And when you learn all about this, you can do that incredible surgeries to get back those patients to their normal life.
Right.
When I studied orthopedic surgery, I remember sometimes when I did practice with a cadaveric piece. Uh, this last is very important in the orthopedic surgeon formation for learn the real functional anatomy. In the
Right.
orthopedic surgery, you can learn much technology about the use of the different materials for the fracture treatment, like steel or titanium in nail plates or external fixator, and the arthroplasty of some joint surgery too.
Okay. Right. So my next question to is it is to you is being an orthopedic surgeon, how important it is to be mentally prepared when you go for a orthopedic surgery.
Well, it's very important for me to be prepared before the any surgery. I always study the surgery maybe 2 or 3 days before because it's the only way to make a good plan surgery. Uh, this gives you how to know all possibilities to how you can resolve some problems during the surgery time. And when you have all these possibilities in count, you can do good work. Sometimes I listen relaxed music during and after surgery. This is really good.
Okay. Nice preparation you go through. So tell
Yes.
us something about your daily routine, how it is.
Okay. Well, I have a lot of work every day. First, in the morning, I go to the hospital for listening the orthopedic resident class, and I can teach them something about any teams in that class. Next, I go to the medical rounds with the orthopedic resident and discuss all the cases in the orthopedic room, planning some surgeries, and finally, discharge some patients post-operated with a good evolution.
Okay.
The morning, when I leave the public hospital, I go to the Maracay Medical Center. It is a private hospital and check a lot of orthopedic patients where I can to apply some procedures, refer to other specialties, and planning their surgeries at the afternoon.
Oh,
When I have a surgery day, I don't go to the hospital because I have a lot of work in the surgery room. Sometimes this is a problem.
okay. So my next question to you is, according to you, How important role does physiotherapy play after any orthopedic surgery when it comes to recovery?
Well, nice question. Well, when I talk about the role of the physiotherapy after any orthopedic surgery, I need to say one thing. The physiotherapy is like a younger brother or best friend of the orthopedic surgeon. For
Right.
me, it's very important refer my patients to physiotherapy after any orthopedic surgery because it's the only way to get a fast recovery. I can tell you the without physiotherapy, I don't have a good evolution in my patient after any surgery. The
Wow,
physiotherapy is an important part of the evolution after any surgery.
that's nice. I feel proud to be a physiotherapist now. I'm very proud of my career, profession. So my next question to you is, we have seen some of your Instagram posts where kinesio taping was done on some of patients. So how important do you find KT taping on patients?
Oh, really? Well, thank you for following me. Yes, I use frequently the kit taping only in those patients who will need it. For example, in the ankle sprain, in severe muscle contraction, I can will use after some orthopedic surgery for to have lymphatic drainage control.
Lymphatic drainage.
This is uh, very but very important after the orthopedic surgery uh, evolution. I
So,
use
sir,
the kitty taping all time in my patients. It's very nice when you look at the evolution on the patient before and after kitty taping application.
so you perform the taping or the physiotherapist does it?
What?
You do the kinesio taping on patient or a physical therapist does it?
Uh, I, I do. I do.
Even you do?
Yes.
Okay, nice. So, sir, my next question to you is, what kind of orthopedic surgery take longest time?
Mm, well, that's the pain of the injury complexity. For
Oh,
example, maybe sometimes you have to take much time to resolve an open fracture, or when you have to resolve some joint injuries like a fracture or ligament reconstruction. In my experience, I have one case where I take long time to resolve. I remember that was a terrible threat of the elbow. It is very hard to resolve. I remember that patient was a young man with 25 years old. He had almost 30 days with that injury. Uh, you need to remember it's very important take some time to plan your orthopedic surgery. It's the only way to get a good result. Don't care if you need a lot of uh, don't care if you need to take long time to planning your surgery because this helps you to resolve all possible problems in that surgery.
okay. So, sir, most common surgeries that you perform,
Uh, Repeat the question. I can't hear you. So good.
most common surgeries that you perform, the commonest patient you get, the injuries, most common injuries that you treat.
Right. Well, I perform a lot of surgeries, but the most common are those where I have to do long bone reconstruction, like tibia or femoral fracture, uh, some surgery for sport injuries, joint reconstruction surgeries, and maybe an orthopedic surgery in child.
So you deal with pediatrics also.
Uh, yes, I treat. pediatric patients too.
So my next question to you is, does an orthopedic and a physical therapist work hand in hand?
Yes, absolutely. I always work hand to hand with the physical therapist. This is very important to follow the evolution of my patients. It's very important to have a good relationship with the physical therapist. I think the physical therapist is the right hand of the orthopedic surgeon. It is very necessary have a good relationship to get a good result before and after when we treat the patient injury.
So, sir, now my question to you is, who has inspired you in your life and why?
Well, this is a serious question.
Yeah,
Well, uh, but I can answer you. In my personal life, my family is who inspire me
yeah.
because they teach me how to do better every day. Don't care if you are rich or poor. The most important is have a lot of dream and work very hard every day to get it. Uh, this is a short answer, but it's my reality.
Okay, your family has been your backbone. So
Tell
my
me,
next, uh, your family has been a big support to you.
uh, I can hear you the question.
I mean to say is your family has been a big support to you. Your family has been a big
Yes,
support.
it's my big support. Yes,
Right, right.
absolutely.
So my last question, this is the last from the serious question. After this, we'll be coming to some entertaining questions. So my last question is, any advice that you would give to our audience to gain success in their lives?
Yes, of course. It's incredible, but just right now I think about this. Uh, Currently, I can advise you: wash your hand every 30 minutes. Stay at home much time because the coronavirus is not a joke.
Right,
And remember, in this life, nothing is impossible. You can get all your dream if you work very hard for that. And
right,
never forget, believe in yourself.
right, right. So is there your role model, someone who is your role model, whom you follow the most?
Oh, my role model.
Yeah,
Um, well, maybe I don't have a role model to 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 follow him, but I can think my aunt Augustine. He is like like a father for me, and he is the man.
your father is your role model. That's nice.
My aunt,
Your aunt.
yes.
Oh, nice. So, sir, have you ever been to India?
Well, maybe in this life I like it. No new place, and the India is in the list.
Okay, you can come whenever you want. We will welcome you with open arms.
Oh, really? Thanks, man.
So, do you watch any Bollywood movie from India? Have you
What?
ever watched? Have you ever watched any Bollywood movie from India?
Don't I don't understand.
Have you ever watched any Bollywood movies from India?
Boogies.
Movies.
Don't I don't
Okay,
understand. So,
okay, okay, fine. And sir, I wanted to ask you, how do you prepare for challenges every day that you and your patient have to face every day? How do you prepare for it?
Well, I prepare when I'm studied a lot. Uh, I I I prepare my professional professionality and personal. Uh, yeah, repeat the question, please. Sorry,
How do
I
you
have.
prepare for challenges? Challenges that you face every day.
All right. Well, I I I like the challengers, uh, and sometimes I take it maybe once a week. For example, when I take some difficult surgery, uh, maybe I can prepare to take the challenger.
Okay.
Or when you have any problem, and if you can resolve or help you, I can take some challenger.
Okay. And how do you stay fit? When
What?
do you exercise? When do you exercise? How do you stay fit and healthy? Do you exercise? Because
Yes, yes.
so what time do you exercise? How do you stay fit?
Maybe 3 or 4 days a week.
Okay. In the morning you exercise?
No, I prefer at the afternoon or evening.
Afternoon or
It's more comfortable.
and sir, tell us something about your Instagram page, Romulex. When did you start your Instagram page? Tell us that the audience will start, they will start following you.
Well, really thanks. Yes, can you follow me through my Instagram account? This is Romulex with double X in the final.
Okay. So it was nice talking to you, sir. Thanks for your valuable time. And this was Dr. Romulo. He has a very difficult schedule and he has given his time. He has to do many surgeries in a day and he has given his time. We from All About Physiotherapy, thanks to you. And it was nice to talk to you, sir. Thank you.
Oh, really thanks. I appreciate that. Really thanks for the invitation. This is my first experience to interview through the one apps, for example, Zoom. Uh, maybe have some problems, but I am really appreciated for that.
It is a pleasure, sir. And this is my second interview with you. And it was a very nice experience. Thank you.
Oh, really thank you. To have a good night.
Good evening, good night. Take care. Bye bye.
Bye bye.